This is a demonstration of the asthma management assistant. This shows the switchboard from where all the various functions of the program can be accessed. Starting from the first button, it opens up an assistant based on the latest BTS NICE guideline under different subsections. The first section is clinical assessment. Second section shows the alternative differential diagnosis, management plan, how to treat acute asthma, important information about discharge and follow-up plan, indications for specialist referral, and finally a word about prognosis. This button gives you a flow chart starting from clinical assessment to trial of management and recording of response. You can close that form. This is a prototype of asthma personal management plan which can be individualized for each patient. So for a patient, if you go to the discharge and follow-up plan, you can create a specialized action plan for each patient. You need to enter in the name of the patient, the surname. You can enter the birth date using this. You can select the consultant from the list of already entered names. GP details can be entered. Another information, this allows you to select what the patients are currently on. So 2 pulse, how many times a day, and then generate an action plan. If you have the peak flow rate, you can record that as well. So this is what the action plan looks like, which can be printed off and given to the patient. And close this off and then cancel. So close form. The second button allows us to plot peak flow rate in the entering the height of the patient, the recorded flow rate, and the age of the patient, which is optional, and plot. So you can visually observe the patient's plotted peak flow rate against the normal chart for the patient's height. We give the 5th centile, 50th centile, and 95th centile at a glance. And there's a button here that shows you how to use a peak flow meter, just some guidelines on how to use a peak flow meter. And there are a list of references here which are related to asthma and flow meter. And if you click on this, it will open the website for Clement Clark International. Close form. And this is a simple way of measuring or entering the patient's age, calculating the patient's age, and gives you a quick rough calculation. And for preterm babies, you can calculate corrected gestational age. Close form. So that is a brief summary of the things that can be done with this program. Briefly look at what the administrators can do, for which you require a password. You can edit the names of the consultants. Just add all the consultants in the hospital so that you can select one of them and when you fill in the forms, and you can edit other medications the patients may be having, and you can edit the names of the reliever medications, as well as preventer medications. So that is the end of the program, and you can exit by clicking this button.